Carpal tunnel syndrome, or CTS, affects the hand and wrist when the median nerve becomes compressed. This leads to symptoms like numbness, tingling, and weakness in the hand and fingers. CTS is common, especially in women aged 30 to 60, and can significantly impact daily activities. Repetitive hand movements and certain medical conditions increase the risk of CTS. Early diagnosis and treatment are crucial to prevent long-term complications. This video will cover the causes, symptoms, diagnosis, and treatment options for CTS. The carpal tunnel is a narrow passageway on the palm side of the wrist. This tunnel is formed by bones and ligaments, creating a rigid structure that houses several important components. It's a crucial part of our anatomy, especially for hand function. It protects the median nerve and tendons that bend the fingers. These tendons are responsible for the flexing movements of our fingers and thumb, allowing us to grasp and hold objects. The median nerve running through this tunnel is vital for both motor and sensory functions. The median nerve controls sensation in the thumb, index, middle, and part of the ring finger, and fine motor movements of the thumb. This nerve is essential for the dexterity and precision of our hand movements, enabling tasks like writing, typing, and buttoning a shirt. Compression of this nerve within the carpal tunnel leads to CTS symptoms. These symptoms can include tingling, numbness, and weakness in the affected fingers, often worsening at night or with repetitive hand movements. Tendons passing through the carpal tunnel flex the fingers and thumb. These tendons are sheathed in a lubricating membrane that allows smooth movement, but overuse or injury can cause inflammation. Inflammation or swelling of these tendons can pressure the median nerve, contributing to CTS. This pressure disrupts the normal function of the nerve, leading to the characteristic symptoms of carpal tunnel syndrome. Understanding this anatomy helps comprehend how CTS develops and affects hand function. By knowing the structure and function of the carpal tunnel, we can better appreciate the importance of maintaining wrist health and preventing conditions like carpal tunnel syndrome. Carpal tunnel syndrome, or CTS, occurs when the median nerve in the carpal tunnel is compressed. This compression can lead to symptoms such as numbness, tingling, and weakness in the hand and arm. Understanding the causes and risk factors is crucial for prevention and management. Repetitive hand motions, like typing on a keyboard or using vibrating tools, can inflame tendons within the carpal tunnel. This inflammation increases pressure on the median nerve, leading to the symptoms of CTS. It's important to take regular breaks and use ergonomic tools to minimize this risk. Medical conditions like diabetes and rheumatoid arthritis can also increase the risk of developing CTS. These conditions can cause changes in the body that make the median nerve more susceptible to compression. Managing these underlying health issues is essential in reducing the risk of CTS. Anatomical factors, such as having a smaller carpal tunnel, can contribute to nerve compression. Some people are born with a smaller carpal tunnel, which makes them more prone to developing CTS. Understanding your anatomical risk can help in taking preventive measures. Pregnancy can temporarily increase the risk of CTS due to fluid retention. Hormonal changes during pregnancy can cause swelling, which puts additional pressure on the median nerve. This condition often resolves after childbirth, but it's important to manage symptoms during pregnancy. Recognizing these risk factors is key to preventing and managing CTS. By being aware of the activities and conditions that increase your risk, you can take steps to protect your hands and wrists. Early intervention can prevent the progression of symptoms. Addressing these factors can significantly reduce the likelihood of developing CTS. Simple changes, such as adjusting your work environment, using ergonomic tools, and performing regular wrist exercises, can make a big difference. Taking proactive steps can help maintain hand and wrist health. Carpal tunnel syndrome, or CTS, is a condition that can significantly impact your daily life. Symptoms often start gradually and intermittently, especially at night. You might wake up feeling a strange sensation in your hand, which can be quite unsettling. Numbness or tingling in the thumb, index, middle, and part of the ring finger are hallmark symptoms. This tingling sensation can sometimes feel like pins and needles, and it may come and go at first, but over time it can become more constant and bothersome. This sensation may radiate up the forearm and disrupt sleep. Many people find themselves waking up in the middle of the night, shaking their hand to try to relieve the discomfort. This can lead to poor sleep quality and daytime fatigue. Weakness in the hand can develop, making fine motor tasks difficult. You might notice that simple tasks like buttoning a shirt or picking up small objects become challenging. This weakness can also cause you to drop things more frequently. Severe cases may lead to muscle atrophy at the base of the thumb. This means that the muscles at the base of your thumb can shrink and weaken, making it even harder to grip objects or perform tasks that require thumb strength. Symptoms can be mistaken for other conditions, so consult a healthcare professional for an accurate diagnosis. It's important to get a proper diagnosis to ensure that you receive the right treatment and avoid further complications. Early intervention is crucial to prevent permanent nerve damage. If you suspect you have CTS, don't wait. Seek medical advice early to explore treatment options and prevent the condition from worsening. Diagnosing CTS starts with a detailed medical history and a thorough physical examination. Your doctor will ask about symptoms, their duration, and any contributing factors. They will check for tenderness, swelling, muscle weakness, and sensory changes in the hand. Tests like Phelan's and Tinel's sign can strongly suggest CTS. Electrodiagnostic tests such as nerve conduction studies confirm the diagnosis of CTS. These tests measure nerve impulse speed and efficiency, indicating the severity of CTS. Early diagnosis is crucial for preventing irreversible nerve damage and guiding effective treatment. Treating CTS involves a multifaceted approach based on symptom severity. Non-surgical methods like wrist splinting and NSAIDs are first-line treatments for mild cases. Corticosteroid injections can provide short-term relief. Activity modification and ergonomic adjustments are crucial. If non-surgical treatments fail, surgical intervention may be necessary. Carpal tunnel release surgery relieves pressure on the median nerve. This can be done endoscopically or through open surgery. Consult a healthcare professional to determine the best treatment strategy. Ongoing research enhances our understanding of CTS, leading to better diagnostics and treatments. Genetic studies may help identify those at higher risk. Novel drug therapies targeting inflammation and nerve damage are being explored. Regenerative medicine, like stem cell therapy, shows promise for nerve regeneration. Surgical techniques are being refined to minimize invasiveness and improve recovery. These advancements offer hope for more effective prevention, earlier diagnosis, and improved treatments. The field of CTS management continues to evolve, benefiting those affected by this condition.